If we didn't get the power back on, there was the worry would be the temperature would go up too high, nearly 2,000 vaccines in the fridge. They would all go to waste.
Fari, where are you?
Yeah.
You coming? All right. Okay.
I was just in the middle of a phone conversation with a patient, and then we heard an explosion, and then suddenly everything went dead. So the lights went off, the computer went off, my phone line went dead, and the electricity substation had exploded, and so all the power had gone. Now, with vaccines, you have to keep them between certain temperature ranges, and it's quite important that you do. You keep them in those ranges, and that keeps them effective. So suddenly, we had this huge issue where, if we didn't get the power back on, there was the worry would be the temperature would go up too high, nearly 2,000 vaccines in the fridge. They would all go to waste, and not so much the vaccines, it would be the 2,000 people who were coming in the next few days who'd been, waiting for this vaccine, who we've been organizing and getting in. They would all be disappointed. We had people saying, I can get a generator to you in an hour. Everybody was offering to help, and we were so fortunate, and we're just looking through the right options and things that would help us make sure that the vaccine stayed at the right temperature and getting them somewhere cool. We had the CCG was calling us and giving us advice. One of the nurses managed to speak to the Well pharmacy, just which is about a 5-minute walk down the road, and they fortunately their power wasn't being supplied by this substation, so they were okay. And there was a lovely lady at the pharmacy, got her saved as Catherine, the vaccine lifesaver, and she got us space in their fridge, and we got the vaccines in, and everything was fine. But it took a whole lot of coordination of people just jumping to it to get us to that stage. So yes, so the temperature hadn't gone anywhere at all where it shouldn't have. And the vaccines were fine and okay. The CCG, so they looked at it all and they checked it all for us, and they said, yes, that was great. It stayed cold and it stayed right, and it should be okay to use. I think it was such a relief to know that we'd done the right thing, and everybody pulled together, and actually, yes, we did it. We got it. It was just that feeling, the help and the openness and people wanting to help you do this. That was actually one of the most amazing things about this experience. The vaccine, we don't get a whole lot of notice of when it's coming. And certainly with one of the vaccines, you'd only have, a few days to use it. So it means you've got to have everything ready to go the minute you hear. So not a lot of time to plan. So it's been a challenge, but, we were ready for it. We've been all right, but I think certainly some places have had issues with, like the fridges might not arrive before the vaccine, or you might not get the right type of syringes and so there's been lots of these little issues that you've got to iron out and sort before. So they've been rumbling on, and then of course we had our bigger problem that happened last night. On the first day, we delivered over 1,100 vaccines, and the population we were delivering them to were actually mostly 90-year-olds and over, and some over 85s. A lot of the people who came out, I think some of them were saying they'd not been out since the first lockdown because they'd been staying home, and I think they were just really happy to come out. One person said to me, today is a good day. Now I've got my vaccine. So they were very positive about it. We've still got to do our day job, and we're still seeing patients and dealing, and we've got to deal with patients who've got COVID, we've got to deal with patients recovering from COVID, because the hospitals have got busier there. So the people we would normally refer up to them for investigation or for opinions, they're struggling to do that. So of course we're the first port of call, and so people are bouncing back to us. So we're having to handle that. And then we're also doing the vaccine as well. So yes, to say it's got busy is probably a little bit of an understatement.